Good evening. I'd like to call the June 11th, 2015 budget hearing to order. This time I'll go ahead and turn it over to Mr. Hunsaker to announce what's on the agenda.
Good evening, Madam Chair, members of the board. Tonight we have a budget public hearing on the 2016 and 2017 plan budget. This is not a statutorily required budget public hearing. The statutory requirements for county budgets in the state of Florida require the budget to be delivered to the board no later than July 15th. But the statutes also require Board of County Commissioners to adopt a tentative millage rate for trim purposes no later than, why they do this, 35 days from July 1. Last I checked, that would be about August 4th. But they don't say August 4th, they say 35 days. And when you have a budget the size of the Board of County Commissioners budget, and most of the counties in the state have very large budgets, that gives you roughly 2 weeks to get through a $1 billion budget. And I've always thought that wasn't quite fair to elected officials who are responsible for the purse strings of the county budget, of the county's finances, to get an understanding of the magnitude of the programs and policies, procedures, organizations that they're funding. And so several years back, we adopted a process of bringing this budget forward to the board at the end of May and allowing the board a bit longer to review the budgets, talk to the folks that are impacted by the budgets, and when we do that early, we know that some of the numbers will change as time goes on. We don't, for your purposes, in finally adopting the budget in September, according to the state statutes, you have to rely on the property values as determined by the property appraiser on July 1. We get preliminary estimates of property values on June 1 from the property appraiser. We presented the budget, as I said, on May 28th. We took a guess at what the property values were. We were close, but we knew that we'd be off a bit. And we'll just wait for the July 1 numbers. When you come back from your recess, we will update for the July 1 numbers and finalize and update all of the numbers. But you have spent this week in I think it's fair to say, extensive deliberations on going over every organizational budget under the county administrator, a 900 and almost a 1,000-page document. And then we went through the capital improvement program that was several hundred pages.
Almost 500.
Almost 500 pages.
Counting.
Not that you haven't had a good time doing all that. But this public hearing, as I said, is not required by statute. By statute, you're required to have 2 public hearings in September. And I've always thought when we get to September for the final adoption of the budget season is over. And if that's the time you finally ask the public what they think, well, it's over. Let's do it in June and invite the public in to see if they have some thoughts and ideas on how this budget should be shaped. Everything that you've looked at this past week is online. It's available for people to review, download, print, comment on. And tonight we welcome anybody's opinion on that, and I would suggest that the board take that public comment. You have opportunities from now until September to reshape this budget. Again, after tonight, we have a next meeting scheduled on July 30th to take all of the items that you flagged in your deliberations. We will update all of the numbers that need updating between now and then. And that meeting, you will establish the trim rates. That would be the millage rate that when you adopt the final budget in September, the tax rates can be no higher than that rate you set on July 30th. So it's an important day, that July 30th date. I think I'll stop talking there, and I'll turn it back to the chair for any other comments before you hear from the public.
Okay. Anyone else have any comments that they'd like to share before we go to public comment? Okay. As we said, we've had some really good discussions, gone through this budget, all the information that's been online in work sessions, so there's been a lot of discussion, but obviously nothing has happened and nothing will happen until after we've heard from the public and had more feedback. So now is the time to come forward and tell us your concerns, ask questions, things you might want us to look into that might not have been addressed. So I'm going to go ahead and open the public comment portion. If you would like to come forward to the microphone, you will have 3 minutes to address the board on any issue that is of concern on the budget. And if you've been authorized, and I do have at least one person that's been authorized to speak on behalf of a group, you have to have written authorization to speak on behalf of a group of 5 people. But I only have at this point 1 written authorization, but that doesn't mean you couldn't bring it forward at this time. So go ahead and please come forward. I'll go ahead and take Mr. Trujero, or Dr. Trujero, if you would like to come first.
Okay.
We'll have your 10 minutes to present your
See,
reports.
I'll start my timer.
We got one.
We got one.
Oh, you do? Well, I need
Yeah,
one
you'll
too.
see. You'll see the lights blink when it gets close.
Oh,
I don't-
is that one? Okay.
Down,
that
down,
usually
right there in
does-
front of you. There's like stoplights right on the podium there.
Well, at least there's no camera if I go over. I'd like to thank you for the opportunity to talk to you. I started the Citizens Committee for Indigent Healthcare to come up with some different ideas. We don't believe that the majority of citizens in Manatee County believe that there is enough transparency and accountability in indigent healthcare. So what we came up with should not be considered to be a criticism of the vendors or the providers. What it is an analysis of the process to try and make the process better. Dr. Carol Probstfield, who was on the committee, who's president of the State College of Florida, recused herself from voting on this because she's on the Board of Trustees of Manatee Memorial. Our first recommendation had to do with block grants, which is how the hospitals are funded right now. We don't believe in block grants. We don't believe there's enough transparency or accountability in a block grant or an audit trail in a block grant. So we believe that if an indigent healthcare patient is seen, that an insurance claim should be filed if a person with insurance was seen for the same service. So that it should be health claim driven and should be based on, payment should be based on the health claims. At some point in time, the money's going to run out, at least for Manatee Memorial, but they could still bill. We believe that a statistically valid number of these claims should be audited by an independent third-party administrator, a TPA, to assure that the claims were done correctly, and then compare this with national standards. The fee schedule that should be used should be the lesser, for the hospital, should be the lesser of a negotiated Medicare contract or straight Medicaid, whichever is less. That the indigent health care program in a setting of the hospital should get the best price. Indigent health care outcomes should also be monitored and should be published. There's national comparative data for things like congestive heart failure and chronic obstructive lung disease and some other things, and we believe that the indigent health care, hospital care, also should publish their outcomes and compare it with Medicare and other national standards. I think that's important for the people to understand just what the patients are getting and what the taxpayers are getting for their financial support. We also would like to see the Manatee County newspapers, at least quarterly, publish a dashboard which could give information to the county residents, including but not limited to the number of patients were served, where they were seen, the amount of money totally billed, the average cost per patient, and how much was actually spent and how much is left, because the public, I think, wants to know and they don't know. And I think a dashboard would be one way for the public to be able to follow it. And at some point in time, what they're going to see is there's a lot of unreimbursed health care for indigent patients in Manatee County. And they need to see that, and they need to have some transparency and some accountability and an audit trail that they can actually look at, because right now they don't. We had one of our major things. Did you guys get this? Because I sent it to Karen Wyndham on Thursday to give to you in advance because she asked me to. Well, okay. Well, that was the plan. So I apologize that you didn't get it. We believe that the Board of County Commissioners, when it's feasible, should appoint an indigent health care board. It should consist of 7 members, 1 appointed by each of the county commissioners. It should have at least 3 medical people on the board. Unlike the Children's Services Advisory Board, you would say this is the amount of money. It would go to the Indigent Healthcare Board, who said this is how it should be spent. It would go back to the Board of County Commissioners. If the Board of County Commissioners did not like part or all, they couldn't change it. They'd have to send it back to the Indigent Healthcare Board with their concerns, and then it would go back to the county commission. We're trying to take indigent healthcare funding, and this is not to blame any of you, out of the political realm and put it into a citizens committee that wants it to direct it, and that's why it's important to have healthcare people with no conflicts. Unlike the Indigent Healthcare Board, which has mandated members of recipients on it, that should not be on this board, and there should be just a clean, no conflict. We have some increased effectiveness. We believe case managers should be increased, and we believe case managers should supervise certified medical assistants and licensed practical nurses and let them do some case management and let the RNs go out and take care of the complex patients. And there's no reason that that could not be done if that's what they decided to do. We also believe case managers should go after the highest costs in hospitals first. There's a thing called diagnostic-related groups. The government says we're going to pay this for the diagnosis. You should go after that, as well as those consumers, the highest consumers of indigent health care in the emergency rooms, that they also should go on case management. We believe all available healthcare exam rooms, such as the 8 exam rooms at Turning Point, should be utilized. You've got well-equipped exam rooms where the patients can't go because there's nobody to see them. We believe that the physician component of the budget, which is currently $1 million, should be increased to $2.5 million. The physician component ran out in April. Our thoughts are that prudent specialty outpatient care can lead to better outcomes, and better outcomes will lead to reduced healthcare costs. And right now, in April, that's not going to, they're just not getting funded. Let's see. We believe that the emergency room diversion clinics, ERDs in Manatee County, they're by Rural Health Services, should be expanded to include one in Southwest Bradenton, that they should have increased capabilities for lacerations, sutures, and that they should have x-ray. We think that you should use 200% of the federal poverty level as your cutoff, that expenditures should not be limited only to what's statutory, that the hospital-acquired costs, as in Medicare, should not be paid certain complications like getting a urinary tract infection if you didn't have when you got into the hospital and they put a catheter in your bladder. We think you should continue ad valorem taxes until you have a substitute funding. Sarah Cohen, RN, didn't think there should be any new tax at all. We are not in favor of a half-cent sales tax such as what was proposed before. What we are in favor of is a half-cent sales tax referendum if it has 2 components, 2 more components. One, it would sunset in 6 years, which would allow time for evaluation and also by the public to see if it's really getting what they thought they were getting, and then let them go back and look at it again. And the other part that we believe has to be a part of a component or we can't support a half-cent sales tax is the Indigent Healthcare Board. If you want the people to buy into it, I think you need to let the people decide how the money's spent, and so it'd be very important that you have knowledgeable people on that board. What we didn't support was Florida Statute 154.331, which I call the Hardy County model, which was an independent taxing authority, which can do an awful lot from 1 to 5 mills, which would be $26 to $130 million a year, but we didn't support that. I'd like to thank you for listening, and I would like to thank the members of the Citizens Indigent Healthcare Committee who put in a lot of time and effort to come up with some recommendations for you. And I guess there's no questions, right?
There may be, but our procedures allow us to go through all public comment before there's responses back. So we'll hear from everybody, and there may be somebody might want to ask you a question. So
All right, thank you for listening.
stick around. Thank you. Okay.
Wow, and he didn't even take 3 minutes or 10
Doctor.
minutes.
Close.
Yeah.
Good job. All right, I'm going to go down the list from everybody else, the way I had them signed in. Corey Holmes?
Good evening, Madam Board. I just wanted to speak on the issue with public safety. I know the sheriff was here speaking before you, and I think it was Commissioner DeSabatino who flagged the item. It's a critical item, and I just wanted to share a story. A couple weeks back, or maybe 2 months, I'm out power washing my house, and a gentleman rides by walks by and goes into my garage. I called the sheriff's office. Takes tremendous amount of time for them to get there. So happened the captain who works at local district heard the call go out, got the description that I had given them, and they captured the guy. And he's been adjudicated guilty, but he had stole the neighbor's bike. This is on a simple burglary. What's going to happen when we have the significant cases such as shootings? The sheriff can't meet it with the services that he has been provided. I think it is unreasonable of the administrator to not cooperate. The sheriff has been here numerous times, begging and knocking at that door. We've even seen this by evidence of EMS services, the call for service with Larry. I mean, we have to do something. This county is growing. We keep allowing development without even a question, but we have the audacity to question the sheriff. He's a constitutional elected officer. I support him openly, and I'm asking you each to not debate this issue. Let's move forward. Let's give the sheriff's office the tools they need to be successful, to make our county much safer. Thank you.
Thank you. Next up, I have Doug Mahuka. Sorry if I butchered that.
Closer than most people get. All right. Again, my name's Doug Mahoka. I'm a paramedic with Manatee County EMS. All right. In an article in the paper a few weeks ago, it showed basically an admission from our administrator that the county employees are very underpaid, and that the employees are being lost to other agencies, and basically we've exhausted the talent pool in the county. Now, to combat that problem, the recommendation of, I believe it was said, a 4% raise to all employees without increasing the employee pool despite the population explosion. Speaking in regards for EMS, I don't quite understand. If the problem is known that we cannot keep our employees and the difficulties to fill the vacant positions with qualified personnel, we end up with massive amounts of overtime and drafting, which is forced overtime. EMS, we already work 56-hour work weeks prior to all this overtime that we're forced to take. For me, I've been here 15 years. One of the few old-timers left. In my position, the pay range from your last Evergreen study still has me less than half the way up the pay rate, or the pay scale. We have been without a real raise for approximately 8 years. I completely understand why we cannot keep our employees. You had to go outside the county, even the state, to get our new director and chief. They're very qualified. You hired them for a reason. Please listen to them. Thank you.
Thank you
Thank you.
very much. Next up, I have signed up Sandra DeLand.
Hi, I'd like to thank you all for this opportunity to address my opinions and concerns. I'm here in support of Sheriff Stube and his request for increase in budget. I think that what he's asking for is quite reasonable, and I feel like it is actually necessary. I'm a homeowner and a registered voter and taxpayer here in Manatee County. I've lived here for 24 years, and I've owned my home for 15 years. At the present, I am what's considered underwater in my mortgage because my property value has decreased so badly that it's way below what I owe for a mortgage. I live in West 30, which is the crime center of Manatee County. I am there, I enjoy my house, I love my house, but my neighborhood is really bad. Just because I live in a bad neighborhood doesn't mean that I should be penalized because I am a law-abiding citizen. Sheriff Stube and his deputies are very prompt, I find, in patrolling this area. They do a really good job on patrolling it and making efforts to keep things going good. I've had the privilege of going on numerous ride-alongs with the sheriff deputies, and this is, anyone that hasn't gone on one should really do it because it's an eye-opener. You get to see what goes on in the city, especially at night and on the weekends. And what these deputies do is really amazing. They not only are making the law, fulfilling the law obligations, but they're also connecting with the citizens in the community. And they have a check on all the problem areas of this zone that I live in. And they watch over it, and they communicate with residents, and they keep an eye on ones who could become problems. Manatee County is growing at an immense rate with all the new developments and stuff. And just because these new developments are gated and they're six-figure homes does not mean that they're immune to crime. Matter of fact, they're going to be more prone to crime because people are going to have more expensive things, and the criminals are going to go there to exploit this. So I'm asking that you consider Sheriff Stube's request and give him entirely what he wants because deputies are leaving Manatee County and going to Pinellas and Hillsborough County. They're being trained here in Manatee, and then they're leaving. Now, to me, this is not cost-effective because the cost of hiring and training is not feasible when you think of how much it would be just to give Sheriff Stube what he's requesting in his budget. Say, I've been here for 15 years in my home, and I've seen the neighborhood deteriorate badly, but law enforcement is doing a really good job on what they're doing there. We're in a climate right now where law enforcement is under serious problems with crime and stuff, and they're targeted now. So please give Sheriff Stube what he's asking for. He really needs it to keep all of us safe. Thank you.
Thank you. All right, that's the last person that had signed up, but anyone who would like to address the board, you can just come forward and state your name for the record, and you will be given 3 minutes to address the board, so. And Sheriff, if you need a little extra time, we'll be glad to give it to you.
Thank you. I'm Brad Stube. I'm your sheriff. Madam Chair, Commissioners, Mr. Hunzeker, and Mr. Wright. Yesterday, during our presentation, there were several requests made by you in regards to some information that we had provided. First of all, I had a conversation with Commissioner Smith this morning in regards to the African-American ratio population versus the population of the county, and I've given him that information. Also, there was a handout given to you that we didn't receive from FDLE. We have taken that, and we have an explanation for you, which is the first 3 pages. And then one of the other requests that you had was really an outline, and I had heard 3 years, but we actually gave you from 2009, 2010 to our proposed budget. And you were specifically asking about the operating expenses, so everything is here for you. So I give that to you, and really that's all I have. Thank you.
Okay, thank you.
Thank you, Sheriff.
Okay, and you'll share that information with all of us, Robin, right?
Yes.
Okay, thanks.
So we're not, okay.
Okay, anybody else who'd like to come forward? Again, this is the first budget hearing. There will be others, but if you have anything that you'd like to address at this time, Please come forward and state your name for the record. Okay. Seeing no one come forward, we're going to go ahead and close the public comment portion of this budget hearing. And I'm going to go to the county administrator because he's first signed up on the board.
I don't think I signed up.
Well, I had you up first on my board, so perhaps you might indicate again, there was a lot of concerns about healthcare, and Dr. T
Well,
and his group have done a great job of bringing forward recommendations, so I know this commissioner appreciates it. Could you tell about when we're going to be discussing healthcare in a little bit more detail? Because obviously, tonight is not the night because we don't have the details. We haven't had a chance to look at what you sent in, and we don't have all the number breakdown. We're still waiting, of course, for the state, but perhaps you could elaborate on that.
Thank you very much. The discussion we had with the board earlier this week about the healthcare is that we've set aside some money in the budget. We will have a workshop in August. Hopefully, the state and the feds will stop their wrangling and we'll have an answer as to what the rules are for healthcare in the state of Florida. And we will schedule, it's yet to be scheduled, a specific date, but it will be publicized for a workshop to discuss healthcare going forward in Manatee County. At that point in time, the board should have had the opportunity to read the report, to take it under advisement, and to participate, and for you to participate in that workshop, and other interested parties, so that by the time we get around to, the board gets around in September to adopting this budget, we know what and how it is that we're going to manage the healthcare needs of the community, and what process will be used and what procedures will be followed, what policies need to be established, what partners we need to partner with. And if one workshop isn't enough, we'll schedule two. If two isn't enough, we'll schedule three. It's a very important issue in this community. It involves a lot of partners. There's a lot of community interest. And we need to have the legislature finalize whatever it is that they're going to do in order for us to take up the issue on a local level. So when that date is established in August, we will advise everyone, and we thank you for your participation here this evening.
Okay, and of course, we're all available if you want to set meetings individually to discuss any plans that you have, and I'm sure if we have questions, we'll reach out to you on this data. Okay, I've got a couple of commissioners on the board want to ask some questions or make comments. Commissioner Baugh?
Just a few comments. Dr. Triguero, it's the best plan I've heard yet. It's the only real plan that I've heard yet. And you really had a lot of great things in there, and I want to say thank you to the people that was on your committee. It's a good start. I don't agree with everything, but a lot of it I do. So I would love to sit down and discuss this with you further, if at all possible. It's really what I have been asking for, in a sense, for over a year. You know, I want the healthcare organizations to get together and come up with a good plan. You know, for me, doing the same that we've been doing is not the answer. It will never be the answer for me. We need to change it, and if we're going to do something, let's do it right. So I really like some of the things that your committee has come up with, and I appreciate you taking the time to come down here and speak on behalf of them. Moving right along, Doug, I understand. I agree with you. I do think that the new public safety director is going in the right direction. I think he's a breath of fresh air. I went to the luncheon not long ago for the awards that were given out, and I got to tell you, big difference this year in just the feel of the whole room. I mean, it was so much easier and more enjoyable. Everyone seemed much more at ease and relaxed. I know that you have a union involved, so we're not really, you know, the commissioners ourselves, we're not involved in the negotiations that are going on. I know that there are negotiations happening. I got my fingers crossed because you guys work very hard. You're part of the backbone of this community. So I know where you're coming from, and I agree with you. I just wanted you to know that. Sandra, where is she? There you are. I agree with you too. And you know, most of us I know have done ride-alongs with the sheriff. I'm due. I haven't done one in a long, long time, 4 years almost. So I need to schedule another one. You know, the good thing about Manatee County is we do have some areas where the neighborhoods have run down a little bit, and we're going to try and do something in the future with a TIF that we've started, and you know, we want to make a difference in that regard. And the good news is we do have a great sheriff's department. Crime rate is down. We want to help him keep it down. So I appreciate you taking your time tonight and coming in here because it shows that you're caring, you're community oriented, and that's what we need. We need a lot of people like you. So I just wanted to say thank you for coming down here tonight. And I can guarantee you that most of us sitting here, I can only speak for myself, but I'll guarantee you that we all agree with what you were saying. So just wanted to say thank you. And that's it for me. Thank you.
Commissioner Whitmore.
Just real quick, I want to respond to Mr. Holmes. I was actually the one at Commissioner Bussel's side when he collapsed, and I wasn't ever concerned about the time, but others had asked. We got a report, and actually we fell within the appropriate time. It was not extended. I think it was 7 minutes and something, and it's a formula. We did get it brought to us, and so the commissioners were told, because I think some thought it was longer, but it was fine. So there was no person's health at risk at that point. And I do that mainly to stick up for the EMS. You know, I had to say that. And just so you know, you haven't been through our maybe 15 hours of budget meetings in the last 3 days. We, as commissioners, flagged to have staff look at North County and another unit to go out there. So it'd be a 19th unit. So we do realize that you guys need the equipment and you need the staff to do their job when the county's expanding. And so Ed is going to look over that during the break. And Vanessa has said it very eloquently. There is a union. We can't talk about salary, but your message has been heard, and it'll move forward on that. Dr. T, thank you. I've been talking to Dr. T off and on during this thing. He's kept me, he's called me, and I know he's called others too, about the good work they've been doing. Karen Wyndham has been attending the meetings as a background, just kind of, if they needed information, she'd get it for them. So there were some good ideas in there, and like Vanessa, some I love, some I'm, on the fence on, but at least you presented something. And there is another group of citizens, business owners that aren't medical, and people that have also started another group to come up with another plan also. It's kind of a plan, just from me knowing, because I met with a person yesterday, knowing what this plan is, it kind of all gels together. So there are citizens out there and that are actually looking at this. They're taking the politics out of it, thank God, and we're trying to do what's best for the community. So thanks, Dr. T, and I'm sure we'll be talking about all this soon, and at least it's getting the ball rolling, and you did a lot of work. You guys had a lot of meetings, and you had a lot of research, so I appreciate all you did.
Commissioner Smith.
Thank you, Madam Chair. I have an appointment tomorrow morning with the county administrator that we had set, and I'm interested in public safety too, Sheriff Department, emergency services, and lighting, lights and things like that in the community with the conditions of the community. And the county administrator had a brilliant idea, so I want to discuss that a little more in detail with him tomorrow. But, we have the same concerns. I won't tell you.
He keeps one out. We don't know what it is.
A brilliant idea. Stay
He said that
tuned.
2 days in a row now.
I had to get to this 9 o'clock a.m. Meeting, but he had a brilliant recommendation dealing with law enforcement and community issues and stuff. And I'll bring that back to the attention if you don't know what I'm talking about. But I don't want to say it here until we talk a little more in dialogue, because we didn't complete ours. I'm concerned about all of these different aspects. I understand what the sheriff is going through with the community issues, with the deputies, with retirement. His new captain that's going to take over the north side. I talked to him today, matter of fact, going up on on the elevator who's gonna take, over north of the river, Flagstaff in September. We talked about 2 or 3 minutes on the elevator, and so we understand that. We know we need strong law enforcement. We know we need to keep emergency services satisfied too. And we know we need to look at the quality of life. So we're very concerned about it. In digital healthcare, that's a good plan that you made, Dr. T. You know, it's one of the best ones, like Commissioner Bob mentioned, that I really heard before, to be honest with you. Give you something that you can work from, and I think it's a great idea with some of the stuff that you had in there. It give us something that we can start with. So we do have the concern. Remember, we work for you. We work for you. The bottom line, we need to hear what you need to say, and you don't need to be afraid to come forward and voice your opinion on whether you agree with us or disagree. This is the time to agree or disagree, you know, and disagreement is good too. Sometimes you could educate us on disagreement. So we hear you loud and clear, and it's a tough situation that we have, and so we got to deal with it. It's my first budget dealing as a county commissioner, but we hear your passion, we hear your concerns. We understand that you have families and you made commitments and things, 15 years and raises and things like that. Hey, I get it. Trust me, I really do. And so we're going to do whatever we can, personally, me as a county commissioner, to do what's in the best interest of the community, the best interest in public safety, law enforcement, you name it. So we just really got to make some tough decisions. We really do.
Okay, that's the last person that I have on the board signed up to speak. So, again, I want to say thank you to everyone that came out. All of the detail that we have been discussing, all of the background, the financial situation that we're in is online. All of the information about the revenue sources that we have, what all the various departments have presented to us on what they would like to see is also part of that large book. It's called the Decision Unit book, is all there online for everyone to see. So there's a lot of information. The reality is this community continues to grow, continues to have challenges to be able to find the financing to meet all of the needs. And I don't think that's a surprise to anyone in this room. And so we do have tough decisions, Commissioner Smith, to make. And we don't know exactly what the revenues will be. Of course, we find out as of July 1st, or is it July 1st, right? We'll
Yes.
find out what the expected tax revenues are that we're working with. But we've set money aside for indigent care. As everyone knows, the corpus is gone, so almost entirely all gone. So we have set aside some ad valorem revenues, but we're not going to do things the same. We're not going to do them the way we have. You know, this community can solve its problems if we work together. I believe that.
I do too.
And so I appreciate folks coming forward with ideas. It's going to take a lot of ideas. It's going to take a lot of work. It's going to get to the transparency that we need to get to. And I agree with that 100%, that it's going to take a lot of work to get there. But we can do that. And I believe that we can solve a lot of these issues. We may not get everything we want, but we're going to work very hard as a community to have more discussion, more answers, and be ready when it comes time to set the millage. That we, as the board representing you, the people that pay the taxes, we of course pay taxes too, we'll feel comfortable that we're doing the right thing for this community. So again, I appreciate everyone coming forward. I don't think we have anything more to discuss this evening.
Nothing more to discuss this evening. I think you've had quite the week, and so
Well, next week's going to be rougher.
we'll see you Tuesday.
Okay, thank you. This hearing is adjourned.